It is my pleasure to welcome you to the 5,582nd meeting of the Rotary Club of Chicago. Well, for our thought of the day, I would like to share with you a video that we have received from the Rotary Foundation that involves us all. And Shelby, may I ask you to play the video now?
Raindrops fall from the sky. They may be small, but together they make a mighty ocean. In the same way, your commitment to doing good in the world enables the Rotary Foundation to fund the projects that you care about. Last year, even during a pandemic, hundreds of thousands of donors like you gave more than $440 million. Your generosity allowed the foundation to fund more than 2,000 global grants, creating opportunities for people everywhere to respond to their community's unique needs. A $15 donation could buy polio vaccines. A water filter cost only $50. And $100 could provide COVID-19 training. You supported causes such as fighting disease, building strong communities, and promoting lasting peace. So whether you gave $1 or $1 million, you gave help and hope. The people whose lives you've touched, the families, the parents, the children, thank you. And so do we.
Well, it has been quite extraordinary that in spite of the pandemic and all the problems we've had and so many people who suffer from COVID, Rotarians deliver to the Rotary Foundation, and we know how powerful it is. Many clubs, including ours, we have our own Rotary Foundation that funds our, both local and international projects. But I cannot stress enough of how important it is to support both foundations. So with that, also what I would like to mention today is that it has been a very good year of all of us contributing. But I would like to tell you something, that in the year 2019-2020, the Rotary Foundation first launched the Rotaract Giving Certificate to recognize Rotaract clubs that contribute substantially to the foundation, to the Rotary Foundation. In order for a club to achieve this distinction, at least 5 of its members needed to donate a total of $50. 225 clubs worldwide obtained this certificate, among them our very own Rotaract Club of Chicago. Together, all these Rotaract clubs have raised $66,922.86 for the Rotary Foundation. Please join me in congratulating our Rotaractors for this achievement. And now I'm going to move on with our general announcements. And I would like to tell you that the August 31st meeting is going to be hybrid. And pursuant to the new City of Chicago guidelines, all persons, regardless of vaccination status, must wear masks indoors. You can remove your masks while you eat or drink, but must put them back on when you're not eating or drinking. Okay, and according to the CDC, let me share with you something. Probably you heard it before, but it is my duty of president to share this with you. People who are immunocompromised may not always build adequate levels of protection after an initial 2-dose primary mRNA COVID-19 vaccine series. They should continue to take all precautions recommended for unvaccinated people until advised otherwise by their healthcare provider. Further, the CDC recommends that moderately to severely immunocompromised people receive an additional dose. As many clubs are doing in the US, I would like, as president, to ask you that you present your proof of vaccination to Karen and Tambra when you check in for the August 31st meeting. As I said, it is going to be a hybrid. If you are not vaccinated and are intending to attend the meeting, I recommend, I suggest, I kindly ask you that you join us virtually. Okay, so I trust all of us are vaccinated, but as I said, it is my duty to share this with you. On other aspects of the meetings, all in-person attendees must pre-register and prepay if applicable. And this include our Rotary One Golden Wheel members and the pay-as-you-go members. So you must do prepay in advance when you register. The vegetarian meal is the only special meal available for the time being. Okay, and as you know, we've heard this before, but these are the guidelines necessary as Rotary One and the Union League Club return to in-person meetings. Thank you for understanding, and we appreciate your assistance. Okay, so as always we do, Dr. Ray is going to be talking with us, and we're going to take questions at the end of the remarks. And keep your, I would appreciate one question per member, per attendee, and keep it short because Dr. Ray is going to give us a really good talk, and we may not have time to introduce all the guests, but many of you will already say hello before we all started. Now it is my pleasure to introduce Dr. Ray Hodgson from Australia, who has started traveling to Nepal and has found a dire situation in what had to do with the health for women and young mothers. There's a lot that I can say about Dr. Hodgson, but your story is so compelling that I don't want to take time from you. Dr. Ray is calling us, I think it is about 4 or 5 o'clock in the morning, his time. So big thank you from us for being awake at this time of the day. And I will let you take the floor, Dr. Ray. And thank you so much. And after your talk, I'm going to talk about the book that you wrote, that you're going to also say something about it. So Dr. Ray, the floor is yours. Thank you again for being with us today.
Thank you so much, Marga, for that introduction. I'll try to get my screen up there now. Before I do start, it's an honour to be asked to speak to your club, your historical club, your very famous club. And I see in the audience we've got PGD David Hare and Phil Lustig. It's great to see your familiar faces again. These two gentlemen have been sensational in the way they've helped the project that we're working on with this hospital in Nepal. What I wanted to do tonight, I have to say this afternoon, it's 3 o'clock in the morning actually, Margaret, just after 3 o'clock in the morning, which is fine. As an obstetrician, or as you would say, OBGYN, we're used to being up at all sorts of hours with babies, so it's not a problem at all. Before I do start though, I need to warn people that some of the slides I will show today are confronting with the imaging. And I don't really apologise because I've said it before, but I do feel sometimes we need to be nudged out of our comfort zone to spur us into action. So I do apologise if they're offensive, but it's not a very heartfelt apology because we need to see these sorts of things. It was 11 years ago that we first realised that the state of health, of women's health in Nepal was atrocious. We went over to explore what was going on with the health of women in that country. This is 2010. And we identified two main problems with women. The first of these problems was what we call genital prolapse. And what genital prolapse is this. This is a cross section of a woman's pelvis. This is a normal pelvis, and you can see the bladder here on the left, and then the uterus there, and the bowel. That's where the organs should be. With severe prolapse, they fall out essentially through the vagina. That's the uterus, and pulling with it the bladder and some of the bowel. The uterus should be there, but with severe prolapse, it's there. And that perhaps doesn't look too bad in a drawing, but this is where some of these pictures do get a little unpleasant. This is what severe prolapse looks like in real life. That's the uterus and bladder and the bowel, all falling out through the vagina, and that you can imagine how uncomfortable that is. This poor woman who suffers with severe prolapse is in chronic pain, and she finds it difficult to walk and difficult to sit. She's usually incontinent. Sexual intercourse is out of the question. That's severe. But what struck us was how prevalent that was. It was everywhere. Women like this we saw by the thousands, and we learned that Nepal, for whatever reason, is the country with the highest prevalence of this in the world. There's no country in the world where this is in greater numbers. And not just is it in great numbers, it happens to young women as well. So a quarter of the women with this sort of problem are under the age of 30. Why do they get it? Well, it seems to be lots of reasons. This is one of the reasons why they get it. Their culture is that they carry heavy loads a lot. One of the other reasons is that they have babies at a young age. And this is not a sister carrying her baby brother on her back. This is a young mum carrying her son on her back. And the second problem that we identified was that of mums dying just from being pregnant, maternal mortality. And why do they die so often in countries like Nepal? It comes back to most of the women attempt to deliver their babies at home. And it's not like having a home birth in a country like yours or mine. These are really primitive situations with very inexperienced birth attendants. And about 80% of women try to deliver at home like this. And when there's a complication, it often leads to major consequences. The specific causes, these are the 4 biggest causes of women dying in Nepal. Hemorrhage, usually postpartum hemorrhage, eclampsia, preeclampsia, severe sepsis, obstructed labour. Those 4 things, they're the majority of the reasons for deaths. The shameful thing about this slide, is that every single one of these common causes of maternal death is easily preventable. And we, in our country, you in your country, treat these things every day of the week and almost always successfully. The women in our countries live. But when the women in places like Nepal are confronted with these problems, if they're not in a hospital, they often don't live. And can we put a number as to how prevalent this problem is in the country? We can. But this is what happens when a woman tries to deliver at home. She gets into problems. It's often 2 or 3 days walk or being carried into the hospital. By the time she gets to us, like this poor lady here, it's too late, often. This is a woman who had a hemorrhage at home, an unexpected hemorrhage immediately after her baby was born. The baby did survive. But with the rapid bleeding, she was carried to our little hospital. You can see we had time to put an IV line in her arm. We don't have a blood bank. We volunteers use our own blood sometimes to transfuse into these people, but it was too late for her, as it is for so many others. How common? It's worthwhile comparing it to countries like ours. Here, this is the maternal death rate, mortality rate in our countries. It's so rare. It's represented per 100,000 live births. You probably can't even see that there. This is our 2 countries right down there. The chances of you dying, if you live in the States or you live in Australia, the chances of you dying just because you're pregnant is 6 per 100,000. That's the figure that it varies around each year. That's really, really low. But look what happens if you put on that same graph your chances of dying if you happen to live in rural Nepal. Look at that. That's nearly 100 times your chances of dying just from being pregnant. And every time I see this graph, I'm disgusted. And every one of us should be disgusted. What does that translate to? That translates to the loss of a mother every 4 hours. The loss of a baby every 15 minutes. I say that again, the loss of a mum every 4 hours, a baby every 15 minutes. In Nepal, the population of Nepal, 30 million, it's about a tenth of what it is in your country, an 11th of what it is in your country. That is unforgivable. If those were the figures in our countries, there would be protests down the street. There would be placards, there would be riots at those disgusting figures. And yet, for some reason, we call ourselves humanitarian, and yet we turn a blind eye to this because it's on the other side of the world. I just don't get it. And my team and I could not get that either. You lose a mum. It's a woman who, the center of the family, a woman who's normally in the prime of her life. The loss of a mum, it's devastating to her immediate friends. The loss of a mum, it's devastating to the community. But it's most devastating to the family that she leaves behind. And we just knew 2010, we had to do something about it. So we began our organisation, and because it began in Australia, it's called Australians for Women's Health. And what we do, what we've been doing until recently, is we've been gathering teams of volunteers every few months and travelling to Kathmandu. The volunteers are doctors and nurses and midwives and general handy people and non-medical people as well. We'll travel to Kathmandu. It doesn't look like that much anymore, unfortunately, after the earthquakes, but we spent a day or two in Kathmandu acclimatising. And then, this is the awkward part, we travel to different parts of the country to try to help out with these problems and work in these little hospitals. To get there, this is the hairy part of the experience, is trying to negotiate some of these mountain roads. It really is scary sometimes. These are the worst roads. Most roads are not nearly as dangerous as these appear. Some people say, well, you should just trek. Don't take your risk on those roads. Just Nepal's known for its trekking. It's wonderful. Just put all your medical gear on your backpacks and just trek to these places. This is why we don't trek. That's some of the trekking tracks. And you can imagine trying to do that with a heavy medical gear on your back. So we usually just catch the bus. We get to these places, these tiny little hospitals, which you can imagine are quite primitive. The women have usually been queued up often overnight. There's lots of women by the time we get to these places. They hear about us coming through the community radio. And these little hospitals, I'll just go through some of these pictures fairly quickly, but you can imagine how primitive they are. They are really, really basic. And these are the sorts of conditions our teams have been working under. This is our operating theatre. And yes, that's some of the timber on the wall rotting over there, and mould and so forth. And that's what they endure. I put this up. I'd love to say this is our sterilising unit. Just to compare and contrast, this is an instrument sterilising unit from one of our hospitals in Sydney in Australia. This would look very similar to your modern hospitals in the United States, the sterilising room for the surgical equipment. That's in a modern hospital. This is our sterilising unit there. And that's what the sort of gear that our team has to deal with and have been dealing with. The suction equipment. You need suction when you're operating to get rid of those meddlesome fluids when you're trying to work away during your operation. That's modern suction apparatus from hospitals in Australia. Would be very similar to yours in the States. Our little sucker that we use looks something like that. And I know that looks filthy. It's actually clean inside, but that's the sort of thing that the teams are working with at the moment. We get to work, we start operating, and then the next thing that happens is, some of you may know if you've been to Nepal, that there's a limit of electricity. So there's a grid sharing system. So most days for 1 or 2 hours or more, the electricity goes out. So the teams operate under torchlight, and it seems to work. But it makes us realise every time we come home how privileged we are with the things we so easily take for granted in our own countries. while we're doing this sort of thing, we're operating. We'll hear operating away. We'll hear a lot of noise and kerfuffle next door, and we'll race out when it's safe. And what's happened while we're operating is another woman's been brought in on death's door, attempting to deliver her baby at home. And sometimes we'll be successful in saving her, but many times will not be. So this was our model for the first 4 years of our existence. And how do we get this maternal mortality rate down a bit? We need to get these women out of their homes and try to get them to come to the hospital to have their baby in a safer environment. We need to entice them away from their homes into our labour ward. This is our labour ward, for a typical labour ward for our hospitals. That's not very enticing. And we were not winning that battle. We were not getting many women to come away from their homes to deliver with us. And it's kind of not surprising when you see that. There's a cultural issue there as well, but that's very hard. And the other problem we realised was that as primitive as these hospitals are, it was too risky to operate on a lot of women who tend to have a lot of other, what we call comorbidities. They've got heart disease or lung disease, and it's too risky with our limited hospital situations, without an intensive care, without a proper blood bank. It was too risky to do those operations. So what we decided after 4 years of that was to change that model of just Band-Aid fixing, attempting to Band-Aid fix these problems in different parts of the country. What we decided we would do is just focus on one area of Nepal, eastern Nepal, and this is Dholika. This is the area that we decided would put our energy into this area, and we would raise funds to build a dedicated hospital for mothers and babies where we did have the proper equipment and an intensive care and a blood bank and proper trained doctors and midwives locally. That was our plan, 2014. And we began to raise funds for that plan, that hospital. We began raising funds slowly. What happened 12 months after we commenced fundraising was this. You would all be aware of this massive earthquake, 2015, where just like recently we've had problems in Haiti, thousands and thousands of lives lost, including the area where we're building our hospital. Nearly 9,000 lives lost and hundreds of thousands of people injured and displaced, and lots of our friends and their friends in this area as well. In every sense of the words, this was a humanitarian disaster. Our medical clinics were not spared, and these are some of our medical clinics that were unusable, unworkable, of course, afterwards. And of course, we went over to help. This is 3 Americans here, three paramedics from the States. That's me on the right, going over to help just before the second earthquake. Those smiles on our faces it was only about 20 minutes after this photo was taken, the second earthquake took place. And we're not over there to do obstetrics and gynecology and prolapse surgery. We're there just to do basic first aid. And it was horrendous for doing this. I'll just skip through these. These are just horror pictures of trying to do everything we could with our limited experience. This is a baby. This is not a sad picture. It looks horrible. I understand that. This baby was buried for 4 days. He is alive. After 4 days of being buried, this is him a few days later, and some joy amongst all the doom and gloom. But our hospital, unworkable, of course. The women and the families in these places. This is Dholika again. Just devastation. And these women who are suffering enough from their medical problems have now got this to deal with as well. Most of the women in this picture have lost their husbands or their children or both, and it's hard. I always find it hard to find the words to express the anguish of this picture. We as a team are feeling absolutely helpless with these people now, where their family members are buried under these rubble right near them there. It was probably the lowest point of our time, all the times we spent in Nepal, this picture right now. How did women how did women, what was the effect of the earthquake on women, apart from this immediate disaster when they lose family members? The effect of the earthquake on women was awful. After the earthquake, there was more malnutrition in women. There was more sexual abuse of women. There were more pregnancy complications with women, and there was less medical care. So these people are now almost a crisis point. Our hospital itself now becomes a tent hospital for the next 18 months. Our teams are working out of tent, it's like a MASH tent, I suppose, except instead of the tropical Korean climate of MASH, these are freezing conditions. 2 winters our teams endured through this situation. This is another happy picture. This is a cesarean section in a tent of a baby boy, a healthy baby boy. Again, some joy amongst all this horror. But if there was a strong argument to build a dedicated mothers and babies hospital in Nepal, if there was a strong argument to build that before the earthquake, then that argument now is compelling. It's irrefutable. These women in this part of the world need this hospital desperately. And this is our dream. This is an architectural drawing of what is proposed that we will build. The construction has not started yet, but we will build this. When we raise the funds, we will build this, and this will be very successful. It will serve approximately 100,000 people. It'll have all the things you'd expect from a women's hospital with maternal care and a nursery. But more than that, it'll have state-of-the-art ultrasound, another big tip to improve maternal health is ultrasound. Of course, it'll have operating theatre, but it will have a blood bank. It'll have an intensive care. We will do research and to try to work out the source of these problems. And this is the big one. We've already been teaching for quite a few years, the local doctors and nurses and midwives, but we are going to ramp that up big time. That teaching's so important, it gets a big, extra big font there. Teaching is so important that the whole top floor of this building is dedicated to teaching. The local medical staff and the local nurses and the local midwives and the local physiotherapists. We are going to become the teaching hub of Eastern Nepal. That is our dream. And we will do this. Just when you think things can't get any worse, you can't have any more challenges, surely this little guy comes along and I'm well aware both our countries have been suffering enormously with this, but you would have heard of the problems in places like India. And Nepal is no different in the effects of this virus on that country. The effects of COVID in places like Nepal and India has been absolutely horrible. And you can see why when you're living in sort of conditions like this and you can't get access to vaccinations and you can't hand sanitize and you can't socially distance. It is a massive problem over there as well. Lots and lots of deaths. Of course, the records aren't kept of deaths. The registration is very inaccurate there. The best idea we have of some sort of numbers of people dying is these cremations. There's many more cremations each day as there are in India. Oh, how do the mothers and babies fend this time with this latest crisis, the COVID crisis? How did they fend? I've got to say that those horror statistics I put up about the numbers of mums dying and babies dying at the start of the talk, we had been making inroads in that. Not just we, our organisation, but other NGOs as well. We had been getting those numbers well and truly down of maternal deaths and neonatal deaths. But look what happened over this 13-month period. A 13-month period leading up to April of this year through COVID. The maternal deaths during that time doubled. The neonatal deaths during that time quadrupled. We're essentially back to the start of where we were when all this began, and it's just soul destroying when that happens. Why has COVID affected mums and babies again? They just can't get into the hospitals. We've been gradually getting them into the hospitals. There's not enough hospitals to go around for general care, let alone for mothers and babies. We need to build this hospital, and we need to build this really quickly. And I want to show you this. Margaret, if somebody, you perhaps could just let me know when I've got 5 minutes left. I don't want to go over time, but I've probably got another 7 or 8 minutes to go, I guess. I want you all to look at the fundraising journey that we've had. You can see down there, or you can see on the right, we've converted this to American dollars. We need $1.3 million to build our hospital. And Phil, that number has gone up, Phil Lustig, because the extra land costs and the extra with the shortage of materials with COVID. But this is our journey. We started there in 2014 to raise money, and look how slow that is on our way up to somehow or other to get to $1.3 million. That is really, really slow. And I calculated that if we continued at that slow rate of fundraising, I would be, I think it was 112 years of age before we'd have enough money. And by that stage, the costs, of course, would have gone up. Look what happens right here. I joined Rotary in 2017, and Rotary got on board with this project. And watch what happens now over the next couple of years. Boom. that is how much is that's not purely from Rotary grants and donations from Rotary members. That is from the general public donations as well. What Rotary's done is provided grants to that, and I'll talk about DNA RAG in a second. But what Rotary did to our organisation, it gave us prestige, it gave us credibility. People trusted us now, because Rotary was on board. So whether they were Rotarians or not, they were much more likely to donate. And that is a powerful message there. And I show that graph whenever I can. 2020, of course, COVID comes in now, and this is our problem right now. The funding has slowed a lot, and that's the effect of COVID on most charities. We've still got this gap to get to 1.3 million, and I'll be honest, we need all the help we can to get there. And I don't know how to put this into words properly, but if any club or any person can help us get there, we would be eternally grateful. David Hare and Phil Lustig know I've been practicing this line. I've been practicing this next line in my coarsest Australian accent I can muster. The line I've been practicing is, help us out with any small donation. Would be really, really grateful. Make it a large donation. We'll name a ward after you. We'll name a ward of the hospital after you. Give us a really, really big donation. We'll name the whole bloody hospital after you. That's my line. So still working on that, Phil, David. This is Phil and others who have set up this because of the hospital being devastated with the disaster of the earthquakes. Rotary, the DNA RAG, has set up this platform to allow tax-deductible grants through Rotary to help build our hospital. And Phil might talk about that a bit later, but ever so grateful yet again, Phil, for what you've done there and continuing to do. Fitting out the hospital, you can't just build it, of course, that's an expensive thing. This, you saw the video about the Rotary Foundation before. The Rotary Foundation has pledged to fully fit out this hospital once it's built. Most people know the foundation has this strange rule. It cannot use any donors' funds to build a hospital or a school or any building, but they can fit it out. Every single bit of equipment will be provided by the Rotary Foundation. I'm a proud Rotarian, and this sort of thing makes me super, super proud when I see that. The final thing we need is the training. We need to train the nurses and midwives and doctors. And what I can proudly say is that the work that our teams have put in over these last several years, the training is complete. We're ready to go. We've got enough nurses and doctors and pathologists and cleaners and administrators to run a hospital. We've got all the staff we need. We've got the plans. We've got the land. We just need a building to put them in, and that's what all this is about. This is the plug for the book. I'll just skip over that now. But if you do nothing else tonight, please get a copy of this book. I can't tell you much in 20 minutes about what's going on with Nepal, but there's lots of interesting stories in that. Please get your hands on one of those. If you do nothing else, please read that and get as many people as you can. Margaret's got a copy there. Every single cent of the proceeds from that go to the hospital. This is my second last slide, if you bear with me. And I want to get across the other problem we have with all this through this gorgeous girl who stole our hearts. Zami is her name. She is, believe it or not, almost 15 years of age. This picture was taken a few weeks before her 15th birthday. She is so funny and cheeky, cheeky in an endearing way, not an annoying way. She's smart. She's one of the top. She beats most of the children in her class, including the boys, and that's really unusual. She lives at home with her parents. She's a single child in this one-room hut. And 4 weeks after this picture was taken, Zami was married, an arranged marriage. And so she's moved out of her home with her parents. She's moved in with her new husband and his parents-in-law on their farm. And she's been taken out of school, of course. That was what a waste of time and energy and effort that would be to have a married woman at school. So her education has stopped. And she will be expected to prove her fertility in the first 12 months of her marriage. And so she'll be 15 or 16 years of age with a small, petite frame like that. And if she manages to conceive, and if she has that baby, and if she survives, and that's not a given, if she survives that, she will go on to have another baby in the next year or two and another baby. By the time she's 20 years of age, she will probably have 3 or 4 babies. And because of her frame and her young age and other factors in Nepal, she will almost certainly suffer with severe genital prolapse. So she will be in chronic pain, and she will be incontinent, and she won't be able to work around the farm anymore. She won't be able to satisfy her husband sexually anymore. And there are some wonderful, compassionate men in Nepal. We've met some wonderful men over the time. But there are also some men who are not tolerant of that situation, substantial numbers of men who are not tolerant of their wife who cannot work at home and cannot satisfy them sexually. So there's a significant chance that Zami will be thrown out of her home. And family law, property law exist in Nepal. They exist in Nepal, but the application of those laws is shameful. So she won't get half the goats and half the rice crops and half the mud hut. She will perhaps get the children, but nothing more. It's maybe no surprise to learn that the leading cause of death of women in Nepal is not childbirth. The leading cause of death, childbirth is a close second. The leading cause of death in women in Nepal is suicide. This is gender inequity. This is health inequity. And every bone in my body tells me this is wrong. This is deplorable. And you must feel that same powerful, profound sense of injustice with all of this. This is the way to. What do you do here? What do you do as a volunteer from another country? Do you race in with your guns blazing and you say, "Stop this right now! Stop it! Stop destroying your daughter's education. Stop forcing your daughters to have children when they're only children themselves. Stop this! Stop this! Stop this blatant act of humanitarian abuse of human rights. Stop this straight up. Do you say that? Do you race in like that and scream? You feel like doing it. You feel like screaming that from the mountaintops. You absolutely do. But you know you can't. You realize that, don't you? Because the backlash from that sort of reaction, that impulsive reaction, will have horrible complications. We have limited access to treat these women in the first place. The culture is such a difficult thing to find your way through. If we have some sort of impulsive reaction like you want to do, we will cripple that limited access that we have. We've got lots of things in the pipeline to help with that, including with this hospital, a very powerful community medicine project where we work with the local community. Nowhere near enough time to talk about that now. What I will say is that, the conditions that the teams work over there, they are harsh, as you've heard. It's cold and there's limited equipment. We run out of things often. And, we can't help a lot of people, and it's miserable with the lives that we cannot save. Conditions are harsh, absolutely. But what you've just heard there with this cultural scourge, that is 100 times worse than any of those harsh physical conditions that our team endures. That is the hardest thing of the lot. And whatever we're doing with this hospital, this cultural challenge is a major part of that. And we've got lots of things to overcome that, as I say. This is my last slide. There are beautiful people, and they don't deserve to suffer like this. Nobody deserves to suffer like this. Look, there are so many worthwhile charities out there. Absolutely, I get that. This is. It goes without saying that this is extremely worthwhile. Every one of us, has the opportunity to literally save the lives of thousands of women every year. Every one of us has that opportunity. Every one of us has the opportunity to end the misery of countless thousands of other women in this country. There are challenges. Absolutely, there are challenges. Every few weeks, there seems to be a new challenge. There's earthquakes and COVID and cultural challenges. Of course, they are there. And there are cynics. You would hear the cynics. Oh, you're never going to fix this. Poverty has always been with us. We'll never overcome poverty. You don't know what to do. You don't know how to do this. I could not disagree more. We do know how to do this. We do know how to fix this. We absolutely know how to fix this, and we just need to do it more, and we need to do it better. Yeah. And right. With your help, we'll do this. So what I say is, let's not turn our backs on those challenges, hide from. Let's grab those challenges with both hands. Let's embrace those challenges, and let's show the world that as Rotarians and as individual human beings, let's show the world that we can make a major difference here. Thank you.
Ray, thank you so much. I think more than one person that is attending this meeting is saying, well, thanks God Marga has to speak, because I wouldn't have the voice coming out of my throat. But stunning, terrible. And yes, I started reading the book, and please do, because you're going to go through it so quickly. And Dave Hare has sent us several books that we're going to bring on our meeting on August 31st, that we have a hybrid. And yeah, it's hard to say. We have to say thank you for what we have, and thank you for bringing to our attention the reality, because most of us have seen pictures of the earthquake without going into the detail and the powerful images that you have showed us. So you have shown us what Stephanie Lippian is telling me. She's our co-chair of the International Services Committee, that we are going to be talking about your project and your proposal. I think we have a meeting next week. So hopefully you're going to hear from us, and I hope this is not the last conversation. So allow me to say thank you for this powerful presentation. You touched a nerve on many of us. And I thank you also for being up at 3 o'clock in the morning in Australia. but that's the way you do it. And congratulations on being a Rotarian. I'm so happy that the Rotary Foundation is fully supporting you, fully behind you. And yes, that hospital will be equipped if the foundation says it is going to happen. So thank you, Dave and Phil, for connecting us with Dr. Ray. And we look forward to being in touch with you. So thank you.
Thank you, Mark.
Thank you so much. And what we would like to offer you is a certificate that recognizes our gratitude that you came to speak to us, and hopefully we're going to be able to help your hospital. So certainly we are going to be in touch. Okay.
Thank you, Margaret. It was a pleasure to be here.
Thank you, Ray, so much.
Thank you.
Bye.
Bye-bye.
Oh, well, that was quite a stunning presentation. Let me catch my breath again. As I said, you're going to have the books available. You're welcome to purchase them online, and we'll deliver them when you come to the meeting next time or the following time. We're going to have those meetings at those books at the Union League Club.
Margaret, may I just say something? If you do purchase them online, Amazon takes quite a large percentage of the $30 they charge.
We're going to send them internally through us, Dave. So Amazon is not going to be involved because, as you know, they're more expensive on Amazon and they take a portion. People our members who are friends who can buy them, they're going to do that through us. So all the money will go towards the clinic.
They can also get them direct from me if you're out of books with no charges going to Amazon.
Great. Thanks, Dave. Okay, so we have, I don't know if we're going to have time for questions and answers. We might do those later, but I would like to inform our members that with regard to another tragedy we're experiencing closer to us, which is the Haiti earthquake, our district 6450 has an outreach. And please take a look at the slide. District Governor Jane Hopkins is inviting us to send a $100 contribution to this effort. So please take a look at the gyrator and see what you can do for Haiti. At the same time, next week, we are going to have a Rotarian from District 2070 or 7020 that will talk about what efforts are also made. But in the meantime, what you can do already this coming Friday, if you have at home some gently used orthopedic goods, please bring them on Friday to the round table or at from 11 o'clock to noon at the Union League Club. Our fellow Rotarian Bernard Groth is going to be there, and he will pick up if you have used boots or sandals, knee braces, shoulder braces, arm slings, whatever it is that you have, because he's finding a way to send all those things, because we hear from this district in the Caribbean that all those supplies are very, very much needed. So pack them in a bag and bring them to the Union League Club on Friday. Okay. As always, with Rotarians, as Dr. Ray has experienced, when you become a Rotarian, really important things happen. So not only to you, but they can be a life-changing experience to be a Rotarian. But Dr. Ray has a very good story. But so invite your friends to be a part of what we do. This year, as you know, we're serving to save lives or to change lives. And this is what we do in Rotary, whether it is in our neighborhoods or on the other side of the world. Okay, fellow members, take a look at the next slide. We have the upcoming committee meetings. The International Service Committee is meeting this coming Wednesday at 5:30. If you are not a member, attend anyways, because we have two important initiatives that need our help, both in Nepal and Haiti. We're working on Afghanistan as well. But we don't have information or specific requests yet. I would like to announce that on August 27th, August 21st, the next meeting, we have Susan McConnell, who will speak to us via Zoom. She is the executive director and the founder of an organization called Let It Be Us. Take a look at the gyrator. This is another compelling topic that involves our children in the United States. And on September 7th at 5:30, to lighten up the mood, our first Rotary After Work meeting of the month is going to take place at the Belgian Consul General's residence. It's going to be a beer night, Belgian beer, of course, and it's just a social program. So you're all invited to attend, need to register. And I understand that if there's going to be inclement weather that night, the event may be canceled. So pray for good weather. So far, it's been really good. We have, I think I'm going to pass with introductions, and I want to thank so many of you who are visiting us today. We have Nadia Navarrete from Argentina, our loyal visitor from Sydney is here. Okay, and sorry, I think I saw, okay, Stephanie, please take a look at the chat box. Stephanie wrote a message to all of you. But, is Dr. Ray, you are still here. So, you know what, let's take no more than 10 minutes for questions and answers, because this has been very powerful, and I'm sure more than you has one question. So whoever would like to ask a question, please raise your hand. But before that, I see Phil's hand that is raised.
Yeah, so, I'm not to steal from Dr. Ray, but because she's like, there's a couple of things. As you know, and Ray so clearly stated, the foundation will not pay for bricks and mortar. However, money that comes in through the RAG is not going in through the foundation. And hold on a second. Let me see if I can get this off my screen. Might I share for 1 second?
So Phil, what you're saying is, I guess through the foundation that there are going to be global grants, but as you know, the Rotary Foundation does not cover the cost of construction, but need the hospital to be built. What
I've got up here, this is from our webpage, dnarag.com, dna-rag.com. It's our mission statement. This is I'm drilling. Oh, wait, let me Rotary in Action. We have a tab here that says Australians for Women's Health, and there's a donate now button here. Okay. And helping build the hospital. Ray, we need to bring this up to date. I'm sorry.
Oh, Phil, it is up to date. I'm sorry.
It is up to date on the website. So, yes.
But our thermometer is not quite right. But
no, but we have it up to date in our newsletter, I think, Phil. Okay. So, yes.
And but I just want to let you know that. And the other thing I wanted to show you, well, that's the wrong one. Hold on. This one here. This is the amount of money that is currently we're holding for Ray, $21,090.30. As soon as he tells me to pull the trigger, we'll wire that money. David and I have been talking about this for a couple of months.
Okay.
So that money is not restricted. Okay. It's restricted as far as it going to Ray, but it can be used for construction or any other purpose that they see fit. Okay.
Okay.
So.
Well, I just wanted to say hello. This is Marvin Preston, a Rotarian, who's also the Honorary Consul General of Nepal. I enjoyed the program very much. Thank you.
Thank you,
Thank you.
Marvin, very much. We appreciate you being present with us today. So let's definitely stay in touch. And if you have more questions, we can connect you with Dr. Ray.
Fine. I also serve on the board of directors of the American Nepal Medical Foundation. I have for about 15 years. So if I can be, if I have any questions, I'd be happy to answer it.
Thank you, Marvin. It's good to hear from you.
Thank you, Doctor.
Okay, very good. Richard Sigley, I saw that you have a question to Dr. Ray. Would you like to ask him the question?
Oh, yes. Thank you, Marga. Dr. Ray, I want to say how much I appreciate your work and your commitment over many years. It is truly exemplary. When the hospital is built and you are using it to train staff from your region of Eastern Nepal, could you speak a little bit about how you see your hospital helping to support better care for women and children more broadly in Nepal?
Yeah, thank you for the question. It was Richard, wasn't it? Yes, and your comments. Yeah, we and we're doing this already at there's a hospital 1 hour from Kathmandu where we're currently doing the teaching. That hospital is called Dulikal Hospital, and it's a lot of the teaching is similar to what we're doing with our own medical students here in Australia with the teaching of the future. You may well be aware is simulated models, has a lot to do with that. Simulated computer models, and much in the way that pilots have been training for many years with simulated flight screens. We have patients, or essentially robots, who we can feign having different complications and hemorrhages and various complications of labour. We can mimic operations to train doctors in that way. That's how we train our students here, and I presume that's the way your students are trained in the States as well. That's what we want to bring in as well. It's one of the big things we want to bring into our lecture theatre, which is on the top floor of our hospital. I didn't really talk about that tonight. It's a separate lot of funding that we'll be applying and we will be seeking, but we're in consultation with the manufacturers of that equipment who we've purchased that for our own hospitals and our own medical schools here. We're in consultations with the company that makes that, Lardell, to hopefully give us a substantial discount for those teaching apparatus. The other thing we're doing is actually with patients themselves. The way we teach our own junior doctors here is with the actual operations and with the management of labours. I'm not sure. I would imagine it's the same problems that you have with getting doctors and nurses to go to rural and remote areas of the States. I think it's a problem with most countries. Difficult to get doctors and nurses to commit to leave the cities where they much rather work. And we have addressed that problem here by training doctors regionally, training them rurally, getting the doctors to come from those rural areas, train them in the rural areas. They're much more likely to stay. And that's the model as well that we're bringing into Nepal. Seek local people from local areas, train them locally, and we're expecting to have that same response, that they're much likely to stay in those rural areas. If that can partly answer your question, Richard.
It does, and I'll send you my email in case anything I can help with on the U.S. is of interest.
Thank you. I'd really appreciate that. Yeah.
All right. Thank you so much. Stephanie, I think there is something you would like to share with us.
Yes. Dr. Ray, thank you so much for taking your time, and to David Hare for connecting us. This has been such an amazing discussion. Your book was the first one I read after I just finished graduate school, and I was crying on an airplane. It's so impactful. But as co-chair with Betsy Meisenheimer of the International Service Committee to all Rotarians, we'll be discussing this project tomorrow. So I strongly encourage you, if you'd like to discuss it anymore and talk about how we can support through our club, please feel free to join our meeting. In addition, just to respect everyone's time, if you have questions for Dr. Ray or about Australians for Health, please email them to me. Over the course of the next week and a half, I will consolidate them and send them through David Hare so that we can get answers to everything and then post those responses for the club and the gyrator so we can continue this dialogue going. And once again, if you want an amazing read, I'm a big library user rather than a book buyer. I would take your budget and buy this book if you're a library user. And please do so through Rotary One, simply because all of the proceeds will go straight towards the Australians for Health and the cause rather than administrative fees. So thank you again for making an impact on our lives today, Dr. Ray and David and Phil.
Thank you, Stephanie. That's beautifully put. I hope the crying when you read my book was not from the bad grammar. I hope it was from the storyline.
The storyline, it was so touching.
Marga, Bill Irvin, Ruth Kaplan, $100 for this project. Thank you.
Okay, thank you so much.
President Huko, may I speak?
Yes, Wayman, of course.
Yeah. Hello, everybody. I just wanted to thank Dr. Hodgson. Just wanted to let you know that was a very powerful, educational, and informative presentation. So thank you.
Thank you, Wayman. Thanks for saying that.
Thank you, Wayman. Irv, we're very grateful for your contribution. We have a very active international services committee. So thank you, Stephanie, for suggesting that we can continue in writing this conversation. I have time for one more question. As I said, we're not going to make the introductions because this has been so compelling that I know you would like to know even more. Is there anybody else who would like?
Margaret, I'm sorry to interrupt. May I just follow up with Richard's question about the training?
Yes.
And this sounds almost like a paradox. We want this to be sustainable. As I think everybody in the audience would know, for a project to be successful, it needs to be sustainable. As far as the teaching goes, our goal is to have the people run the hospital themselves, the local people run the hospital. And the other line that I've sometimes used is that we want this project to be so successful. We want it to be so successful that we're going to do ourselves out of a job. We want to be able to walk away and for them to run that. And we'll be available, of course, for consultation and helping out whenever. But the ultimate success would be for them to run that without our need to even be there.
Mm-hmm. Dr. Ray, one question. How far is Dolaja, is how you pronounce the town where the hospital, how far is it from Kathmandu and how do you get there?
Yeah, it's 5 hours drive from Kathmandu through roads that are not quite as awful as the ones I just put those pictures of those two roads in for dramatic effects, the ones that you saw around the edge of the mountain. They're not they're as steep as that, but most of the roads now have safety railings in them. But the answer is 5 hours. It's only about, in terms of miles, they talk kilometres over there, it's only about 100 miles, I think, or 120 miles approximately from Kathmandu. But because it's such mountainous area with narrow roads, it takes 5 hours to do that drive.
Okay, all right. That seems to be doable. And I pray that there's not another earthquake. So, all right. Also, let me make one announcement about one of our upcoming meetings before we close. On September 7th, on September 14th, we have Jim Stovall, who is an author of 51 books, including the bestseller called The Ultimate Gift. This meeting, if everything goes well with the situation as COVID is today, will also be a hybrid. As you know, it's a touch and go situation with the Delta variant, but so far we are able to hold hybrid meetings. So do join us. That is going to be another compelling speaker, thanks to our co-chair of the programs committee, David Hirsch. So, and all right, and before we close now, I would like to ask one of our guests, Dr. Ray. You know, we have a tradition here, which is we close our meeting reading the four-way test. Would you be so kind to do that for us? And the four-way test is on the screen.
Yes, there we go. Yes, I'd be delighted to do that, Marga. And thanks again for having me on. So the four-way test of the things we do, we say, or we think. Is it the truth?
Is it the truth? Is it
fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned?
Thank you very much. And with this, I close this meeting today, and I can hear the bell perhaps ring. And I'm going to stay here for a few more minutes. So if some of you are willing to stay, and Dr. Ray and David and Phil are also available, well, you know, just stay on, okay? But the meeting is adjourned. Thank you.